I'm Dr. McGraw. Welcome to this week's version of our blog. We're joined with Josh again. We're coming to the end of his experiment. That experiment was to see if active release and chiropractic adjustments will help his performance in the gym. What have you noticed as far as since we started this, seeing you a couple times a week, what have you noticed?
Better flexibility at the bottom of the deadlift. I feel like I'm not stopping, or I'm able to start from a better position than where I was before.
Okay. And we talked about you being one of the best athletes at CrossFit. Your deadlift was really the thing that you thought was holding up.
Yes,
right?
yes.
Okay. Have you noticed any changes in your other lifts, such as squats or overhead squats?
Definitely in my back squat, I feel a lot more comfortable in my back squat. Again, my flexibility is almost the same kind of movement, posterior chain movement, so I feel a lot more comfortable in that position.
And when you're talking flexibility, I'm guessing, but just for those watching at home, here in the hips, right?
More in the hips.
Hips,
yes.
And the back. Do you feel like you get a little bit lower?
Yes, definitely.
Okay. And that should match up with what we're doing with Josh. What I found, if you follow some of the older blogs, is we've been doing active release to his hip flexors, which will give him, if we get rid of some scar tissue that we found in his hip flexors, it'll give him that better flexibility. We've been working on his glutes as well and some of his adductors. What we're going to talk about today is how chiropractic fits in there. Even though active release is a chiropractic technique, we're going to talk about the actual chiropractic adjustments. So let me grab this here. All right, stand up. So if we can zoom in on this, if this is Josh's spine right here, what we're looking at is to see how each individual vertebra move, okay? So when we get down to these different vertebrae down here, and especially with Josh, this one right here, if this is his tailbone and pelvis, I want to make sure these are moving as well as they should, okay? So what we do for that is deliver an adjustment, and we're going to show you what that is, right to this spot in his spine to get that to move better, and that'll take pressure off his nervous system. If he doesn't have pressure off his nervous system because his spine is moving better, then he will have better flexibility. Lay on your right side for me. So an adjustment is applying pressure to that specific vertebrae. With Josh, it's going to be L5 to get that to move better. So what you want to do is roll toward me, relax your shoulders back, relax your shoulders back, there you go. Good. Okay, come on up for me. Sometimes you get a popping sound, sometimes you don't. That popping sound is air coming out of a joint. That doesn't really concern me. We're looking for better motion in his lower back through a chiropractic adjustment. Stay tuned. Tonight we're going to film Josh's deadlift and see if we can come through with some results. Thanks for stopping by.